That's all coming up with Kay. She's back from 9 o'clock this morning. It is now 9:15.
Now, later this morning, Parliament will debate a controversial medical trial into ME, which patients have claimed didn't help their illness, but simply made it worse. A report into the PACE trial released in 2011 suggested that cognitive behaviour therapy and graded exercise therapy were viable cures for the neurological condition. SNP MP Carol Monaghan tabled today's parliamentary debate into whether these therapies should still be prescribed by the NHS. Earlier, she told us that more research into the causes of ME was needed.
This particular controversial and discredited trial has been the biggest piece of research ever carried out, and it didn't include any medical interventions. So it's a huge unknown. It's not known why some people are more susceptible. It is known in many cases that it's triggered by, first of all, a normal type of flu virus that they simply don't recover from. But there's simply not been enough research done.
Well, with us now is Dr. Charles Shepherd, Medical Advisor to the ME Association, and Natalie Wright, a journalist and disability rights advocate who has ME herself. Morning to you both.
Morning, Hayley.
Morning.
Natalie, let me start with you to start by asking how ME has affected you.
Yeah, so I got ill in my last year of university, as was said, with a sort of flu-like virus. And I didn't recover from the virus. I got steadily iller to the point where I was severely ill. I've now recovered somewhat, but it limits my ability to do tasks every day. You know, many symptoms, pain, brain fog. So it's had a huge impact on my life and functionality.
And what have you received or been advised in terms of any treatment?
So the treatment I've received has been very, very minimal, to be honest. I did, after about maybe 2 years of being pretty severely ill, I had a consultation with an expert who was very dismissive and suggested that I was stressed out, and, you know, I was stressed out by the posh boys at Oxford University, and that was my treatment for ME on the NHS, unfortunately.
Well, Dr. Charles Shepherd, I mean, that's really not good enough, is it?
It's not good enough for probably about 250,000 people who have this condition here in the UK. Incidentally, 25% of this group are severely affected, meaning that they're housebound, wheelchair-bound, or even bed-bound. So we do need to find effective forms of, I would use the word management rather than treatment at the moment, because we don't have an effective form of treatment for the underlying disease process. But there's quite a lot that doctors can do to help these patients. And conversely, which is where the PACE trial causes so much controversy, there are things that can actually make people worse, one of which is this treatment that was assessed in the PACE trial called graded exercise therapy.
And why is that not suitable for ME patients?
Well, the problem with the PACE trial and graded exercise therapy is that the whole trial was based on a flawed model of causation. The people who set out to do this trial, and remember we're going back 10 years now since this trial actually kicked off, were basing this on the idea that this was largely a behavioural mental health condition, and that people's problems with muscle function and weakness were all due to inactivity and deconditioning and abnormal illness beliefs. So
and is that no
this
longer
graded
the belief?
Exercise would solve this problem almost overnight.
Right. So has that belief now changed? Has that been discredited?
That has now been, I think, totally discredited. This is a complex multi-system disease that involves muscle, brain and the immune system. And there are now numerous research papers backing up this biomedical causation of the illness. And so certainly when it comes to activity management, people cannot exercise their way out of this. It has to be a process of what we call pacing, which is a very gradual and flexible approach to activity management. It's what patients report they find helpful. It's what an increasing number of health professionals now advise. And it's interesting that over in the States, this advice in relation to cognitive behaviour therapy and graded exercise therapy coming from the CDC, which is the main advisor on management over in the States, has now been abandoned. And we want to see the same thing happen here now that the NICE guideline on ME/CFS is going to be rewritten.
And Natalie, I mean, what do you find works, best, if anything really works for you and how you manage the condition?
For me, again, it's kind of a pacing approach. So to not overdo things, not underdo things, really just try and keep a happy medium. But it's difficult to do this without any. I feel there's no real support available for me or other patients. So you're kind of left on your own, really.
And Dr. Shepherd, 10 years after the PACE trial, has nothing similar, been done? Any similar research into ME?
Well, there's a lot of research, as I say, going on into the underlying cause of this illness, particularly looking at these abnormalities in muscle, brain function, immune system function. But clinical trials looking at forms of treatment and management have been very sadly lacking. And what we do need is a proper trial which is going to look at the proper approach to activity management, particularly in the very early stages of this illness, the first few weeks and months following an acute viral infection, when patients are often struggling to even get a diagnosis of what's going wrong, let alone any form of management. Okay. So we want experienced health professionals to pick up on the idea of pacing, and then for patients to be able to get referral to hospital-based services, multidisciplinary hospital-based services, where they can get good advice on all aspects of management, but particularly activity management.
OK, thank you both very much for speaking to us this morning, Dr. Charles Shepherd and Natalie Wright.
And if you're interested in learning more about ME and chronic fatigue syndrome, do head to the Brainwaves page of the BBC Radio Scotland website, where you can download a free podcast about the subject. This morning's news headlines: MSPs will tonight back